We had the opportunity during this meeting to discuss with major experts in the field about new drugs available to fight and to prevent the coronary artery disease. This disease still represents the leading cause of mortality, and the message is the prevention is extremely important. New drugs are coming out, especially about lipoprotein A, that is a new marker of coronary artery disease and the risk of myocardial infarction. It's a special lipoprotein that increases the risk of thrombotic complications. And new therapies, a lot of therapies have been already demonstrated good efficacy in reducing the cholesterol, LDL cholesterol, and the recommendation is now to bring the LDL as low as possible in order to prevent for primary and secondary prevention. A new family of drugs is coming out, as I told before, about lipoprotein A2. That is a new marker of a new component of lipoprotein that is strongly associated with infarction and the coronary artery disease. Another big issue discussed is about acute coronary syndromes. We have now a lot of drugs and have been demonstrated to safely and efficacy very strong drugs in order to reduce the risk of thrombotic complications. But our population is becoming older and older, and the proportion of fragile patients is growing. Therefore, the recommendation also from current guideline, this is, has been stressed during the meeting, is that the aim is to do a tailored therapy. Therefore, it's extremely important to identify the best option, the best therapy in order to prevent, to maximize the reduction of thrombotic complications and to reduce the risk of bleeding complications. In particular, about the new ADP antagonists, there is now recommendation to de-escalate the therapy, especially in patients, older patients and patients at high risk for bleeding complications. Many new trials have investigated a shorter duration of the APT in patients at high risk of bleeding complications, and such approach has been shown to, let's say, to keep the protection from thrombotic complications and at the same time to significantly reduce the risk of bleeding complications. In addition, we have largely discussed about the novelties concerning the use of intracoronary imaging in acute coronary syndromes. A meta-analysis has been demonstrated, the data have been shown during the meeting, that the use of intracoronary imaging to treat the lesion, the stenosis responsible for the acute myocardial infarction has been associated with a better stent implantation, so a better operation, and with a significant reduction in mortality and stent thrombosis. The use of imaging is also important not only to treat the lesion responsible for the acute myocardial infarction, but also to identify new plaque that may be potential responsible for future events. And the message is also that this is also for the future to further improve this technique in order to identify patients and arteries that may potentially cause some acute myocardial infarction. By using intracoronary imaging, it's possible to identify such a kind of plaques at risk for rupture, therefore promoting thrombosis, and the hope in the future, and new trials are coming out to treat these kind of plaques with stents in order to prevent the future events and future myocardial infarctions.